Health care is a fundamental human right guaranteed to every citizen, irrespective of age, tribe, religious and political belief, as well as economic or social status. However, when it comes to efficient and effective healthcare delivery, many third world countries, Nigeria inclusive, are lagging. Many of these countries are faced with infrastructural deficit, inadequate manpower, infectious diseases, poor maternal and child health care, as well as disease surveillance, poor sanitation, and hygiene. Niger State, Nigeria, has had its share of neglect for many years, resulting in serious dilapidation. Worried by this turn of events, Governor Abubakar Sani Bello declared a state of emergency in the sector to positively change the history of healthcare delivery in Niger State. From 2015 to date, the Governor Abubakar Sani-led administration has attached great importance and accorded priority to the provision of qualitative healthcare services to all its citizens, and especially at the primary health care level, since the majority of the citizens are rural-based. The state government increased budgetary allocation to the health sector to address squarely infrastructural deficit, shortage of essential drugs and supplies, as well as poor human resources, remuneration, maternal and child health care in the state. As part of efforts to expand access to essential primary healthcare services and make a significant impact on women and children, the Abubakar Sani Bello-led administration in the last 6 years had a robust partnership and remained a loyal partner through the consistent payment of its counterpart fund in the bilateral agreement with developmental partners such as the World Bank, WHO, UNICEF, BMGF, and the Saving 1 Million Lives program for results, as well as the GAVI and Neonatal Concerns Limited to bring healthcare services to the doorsteps of the citizens. Interestingly, Niger State is also among the 3 states and the only one in the northern part of Nigeria to benefit from the Basic Health Care Provision Fund. In this regard, Niger State government has remained focused in addressing the infrastructural deficit through the renovation and remodeling of many healthcare centers across the 3 senatorial districts with modern equipment.
This is about the best we've found so far in the history of the state. If you remember, recently, even His Excellency, the Executive Governor, was saying in the council that, in his opinion, this is the first time that we are recording a lot of accomplishment in primary care services in the state.
In Niger South Senatorial District, many rural communities, including hard-to-reach areas, benefited from the state government efforts aimed at improving maternal, newborn and child health care in the area.
The hospital was not standard as it is now. Now, the renovation has bring the standardization of the clinic. Now it's called Niger State Primary Healthcare Katiri.
Many people are coming here simply because of this structure.
The landmark health policy equally made a significant impact on the lives of rural agricultural workers through the construction and reconstruction and upgrading of many primary healthcare centers in Niger East Senatorial District, as attested to by some of the residents of the benefiting communities.
I'm so happy that the government can look into my area and do this kind of work for us.
The people of the community are happy over it, and we extend our appreciation particularly to the state government.
That's not all, as the Abubakar Sani Bello-led administration has also dramatically improved maternal and child health care in many communities across the Niger North Senatorial District. Solar-powered boreholes, overhead tanks, batteries and inverters have equally been provided to ensure regular water supply, and electricity to each of the focal primary health care centers upgraded.
It has been a long time that we have been looking for this privilege, but yet we have not gotten it until now.
Before they prefer to go to private, but now since the renovation, they have been coming here, and we really appreciate the effort.
Throughout the process of the work, the community come daily to see the progress of this work. They are really impressed.
Solar direct drive refrigerators have also been distributed to selected focal primary healthcare centers to improve vaccine storage and quality. Motorcycles have also been distributed to local government teams and officers in charge of the selected focal primary healthcare centers to support outreaches and social mobilization activities at the community level. The Abubakar Sani Bello-led administration has also strengthened the Drug and Hospital Consumable Management Agency to improve the availability of qualitative and affordable medicine commodities in both public and private health facilities, as well as distributed long-lasting insecticidal nets to beneficiaries and target groups. Niger State government, in collaboration with developmental partners, designed and constructed a befeeding office complex in Mina for the staff of the Niger State Primary Healthcare Development Agency. 2 years after assumption of office, precisely in 2017, Niger State government was recognized by the federal government as one of the 8 states in Nigeria that made a significant impact on the delivery of essential drugs to address common childhood illnesses, improve child nutrition, improve maternal, newborn and child health care, among other distinct health indicators.
Presently, we have well over 1,700 facilities spread across the vastness of the state, including in hard-to-reach areas. These centers are the first points of entry into the healthcare system of the state. That's why we call them primary healthcare centers, and they are being managed by the agency. So through these centers, we offer services to people across the communities. And over the years, as we said, we've been able to make impact because despite all the constraints and challenges, we've been able to maintain some level of services across all these centers.
One of the most performing heads of any agency we have today in Niger State, together with the staff of the primary healthcare agency, all of the staffs. They have dedicated their time, their energy, their resources to see that they make Niger life healthier. They have worked day and night to see that they achieve the objectives for which the primary healthcare agency is being set up. Congrats.
Wife of the Niger State governor, who is a career medical practitioner, Dr. Amina Bello Abubakar, added value to the health sector in so many ways.
The foundation works mainly to prevent maternal and child death, and we're working in about 12 primary healthcare centers. Basically, what we do in those centers is we supervise the women who are pregnant in the communities that are served by that primary healthcare center. We do that by having volunteers who work together with the staff in the primary healthcare center to ensure women come for their antenatal visit, and they come and have their babies delivered in the hospital rather than at home.
Realizing the significance of human resources for health, the Abubakar Sani Bello-led administration made concerted efforts which resulted in full accreditation for School of Nursing in Bidda, established in 1976, and the School of Midwifery in Mina after many years of their existence.
We have had a great achievement. Administrative block is on progress.
We also have library which help us to study on our own, study ahead. The innovation of the school, the water supply, the electric supply, everything, a very calm environment that help us to study as students. Anything that we need, either in practical aspects or the knowledge, is always provided.
Since I came, we have street lights around. In the night, everywhere is well lit. We can come out for evening prep without fear. I want to sincerely from my heart thank the state government for this wonderful development that he has brought to this school.
The last professional examination result I came out from School of Nursing Bida, we had 100%, which is a great achievement. We have been commended even by the Nursing and Midwifery Council of Nigeria for that achievement. We are able to achieve this because of the enabling environment created by the present administration.
Niger State government also established an additional College of Nursing Sciences in Kwantagora and contributed to its growth and development.
Nursing schools have never had it so better because under this administration the college was fixed, and now this year we had approval for the establishment of School of Nursing also in Kwantagora. This is a very big plus to this administration and to the Niger State because of the increasing population. The demand for admission into our school has tremendously increased.
The state government has also procured and distributed HIV test kits to primary health care centers and rebuilt the capacity of its workforce in the health sector by training and retraining many health workers drawn from primary health care centers on HIV testing and counseling, as well as prevention of mother-to-child transmission of HIV and also early infant diagnosis. Many trained health workers were also employed, and the remuneration of health personnel improved, resulting in the return of 31 medical consultants in various fields of medicine. The Abubakar Sani Bello-led administration has addressed squarely the poor access to health services, dilapidated infrastructure, low productivity, and inadequate supply of medical equipment, as well as the paucity of donor support and external funding for the health sector. The policy is aimed at reducing the burden and influx that is unexpected by the secondary and tertiary healthcare systems. In the same vein, the Abubakar Sani Bello-led administration also facilitated the completion of extra works and takeoff of activities at the Jummai Babangida Aliyu Maternal and Neonatal Hospital, Minna. In addition to this, some staff of the Jummai Babangida Maternal and Neonatal Hospital, Minna, have been trained at the Imperial College of London on maternal and newborn services to address the level of maternal and child mortality. The 175-bed capacity new wing of the Minna General Hospital benefited from the World Bank as 5 units of the Model B4 Polite Heart Bubble CPSC device were installed at the Special Care Baby Unit of the hospital. Batteries and inverters have also been provided to ensure regular power supply to the new wing of the hospital built to attend to women and children. Minna General Hospital, built in the late 1920s as a railway clinic, is witnessing tremendous facility and expansion services.
Before now, the histopathological unit is not in existence, so that facility or that service is now available with a consultant pathologist, and thus we don't have to send any tissue anywhere out of Minna. It's done here. So the ones we are doing now are the main block B, C, D, and E of the general stamina. Of course, we also study the demand and then the dilapidation of the structure. Those were some of the criteria we used to commence the project.
The Abubakar Sani Bello-led administration has completed a brand new laboratory complex at the Minna General Hospital and another molecular laboratory for testing of COVID-19 viruses and other viruses. Other ongoing projects at the Minna General Hospital are the administration block and reconstruction of the B, C, and E wards.
Is an expansion that is happening in the hospital, and we hope the management will be able to manage it properly.
The welcome development. At least we, Nigerites, we can see that our government is improving in terms of healthcare facilities.
The General Hospital Kontagora, built in the 1920s, has suffered a long-term gradual decay in the entire system and has drawn government's attention. In response, the state government is committing about 1.5 billion naira to reposition the hospital strategically located in Niger North Senatorial District. The Abubakar Sani Bello-led administration has also concluded arrangements to overhaul other hospitals in Tungam Magajia, Bidda, Mokwa, Kagara, and Suleja. Under the present administration, the IBB Specialist Hospital Mina has been upgraded, while the kidney center at the hospital now has the capacity to carry out dialysis in the tune of over 800 sessions per year when it becomes fully operational. Those with such medical conditions will have access to cost-effective treatment and will reduce medical tourism as well as save the cost of medical assistance given to the residents of the state by the government. The hospital now has the Z-arm medicine to enhance neurosurgery and make possible surgeries that in the past were difficult to carry out.
This hospital, when we came in 2015-16, we spent a lot of money to renovate the entire hospital, change the toilets, the air conditioning, everything was new.
Niger State government, in collaboration with a Saudi-based non-governmental organization, has provided free eye surgery for 320 patients with identified eye diseases and free general surgical operations for over 3,000 patients across the state. A cancer management institute that will cater for not only the country, but Africa at large is being established.
This is a new project, newly built, still ongoing. There's still a lot of work to be done. So hopefully by May, June, this diagnostic center will be put to use.
This facility you are seeing here at IBB Specialist Hospital is a multi-diagnostic center where you are going to have both imaging and conventional laboratory services, including wards for admission, which is going to, in fact, for each of this zone of this country, one is hosted in one of the zones. So the one for Northern Central is stationed here. And you can see it's strategically located to the IBB so that the services will be complementary.
The governors better have a consultant obstetrician gynecologist with a master's degree in public health and an advocate for the reproductive health rights of women. Dr. Amina Abubakar Bello has held cancer screening and created cancer awareness, organized several VVF, that is vesicovaginal fistula camps, where many patients in Niger State have had free repairs and have consequently been integrated back into the society.
This facility you see here is one of its kind, with all the technology, equipment and staff, and they provide VVF corrections for women free of charge. So I'm highly delighted that this has taken place now. We have commissioned this today. They have started work. They have started providing services before today.
The governor's wife, in collaboration with other stakeholders, built the VVF Center in Kontagora.
The journey to the creation of this center started here in Kontagora 6 years ago, in the sitting room of my father-in-law and chairman of Mainstream Energy Foundation Solutions, Colonel Sani Bello, retired. We had come to Kontagora for Salah celebrations, and I had paid him a visit. When our conversations led to some requests he had been getting from people who needed help with medical conditions. Among these were women with obstetric fistula, who he helped through an intermediary to get treatment in Sokoto. From our conversation, I realized that the money he was spending in Sokoto per patient could have actually treated 5 women. And so I convinced him to allow me to arrange for a fistula camp here in Kontagora, where we could treat many women at a time for a fraction of what he had been charged previously.
The multi-million naira Social Rehabilitation Center, Mina, remodeled by the state's First Lady, Dr. Amina Abubakar Bello, in collaboration with the state government and other stakeholders, has been inaugurated. On the welfare angle, the Abubakar Sani Bello-led administration has commenced the implementation of the State Contributory Health Care Scheme to make healthcare affordable and ensure an efficient system to ease the burden on the citizenry.
Since government want to make this healthcare available to everybody, there are some people the state government observe cannot pay at all. Whatever you do, they cannot pay. As a government have made provision for these people. And by the grace of God, with the support of Federal Minister of Health, the state government has given us the necessary funding to commence. And we have started already.
With the emergence and outbreak of the scourge of coronavirus, also known as COVID-19, Governor Abubakar Sani Bello demonstrated a proactive sense of leadership by responding promptly and evolved strategies as well as worked creatively with experts to contain the devastating effects of the ravaging pandemic. Without much ado, the governor constituted the State Task Force on COVID-19 with the Secretary to the State Government, Ahmed Ibrahim Matani, as its chairman.
Incidentally, Niger State has been one of the early respondents to the coronavirus campaign. When we started, His Excellency saw the need for us to impose curfew. Many people thought this was too early for a state that never recorded any coronavirus incident. As of today, I think that has been the saving grace.
Through the task force, the state government reactivated its isolation centers at the General Hospital Mina and isolation rooms in all general hospitals across the state. It also established quarantine centers in major cities across the state, purchased respiratory machines and positioned drugs, medical supplies, and personnel protective equipment to the isolation center in Mina. Apart from strengthening the surveillance system to detect any case of coronavirus disease, the state government embarked on the training and sensitization of its clinicians on the management of epidemic-prone diseases and treatment protocols. That's not all. The state government, in collaboration with the Federal Ministry of Health, Nigeria Center for Disease Control, NCDC, and the World Health Organization, WHO, has continued to enforce all preventive measures, especially the physical distancing and hand-washing routines. Other measures taken were the imposition of curfews and lockdowns, closure of public, private, and almajiri schools and institutions, prohibition of public gathering, banning of street hawking and begging, restriction of movement while workers remained at home as the vaccine jabs were taken. To cushion the effect of the lockdown, the state government distributed palliatives to the vulnerable and less privileged across the state.
The manner at which you addressed the COVID-19 pandemic in Niger State is very impressive.
The Abubakar Sani Bello-led administration has accorded priority to the provision of health care services to the citizenry in the last 6 years. It is therefore not surprising that no government has had accelerated development in the health sector like the Abubakar Sani Bello-led administration. In an effort to improve the supply of potable water to the residents of Mina, the state capital, and 4 other major towns with supply problems, which include an aging distribution network, dilapidated treatment plants, silted dams, and manpower expertise. The government cut straight to the heart of the matter by identifying human and material shortfalls and addressing them. Critical infrastructure, such as electromechanical machines, both low and high pumps, as well as their ancillary equipment and generators, were procured and installed. There are some external collaborations to further boost the sector. This is in addition to the borehole provision project initiated to tackle water problems. The Niger State government later approved water sector reforms to bring about the improvement of the health condition of its citizens across the state. The bill has been passed into law by the state legislature and assented to by Governor Abubakar Sani Bello.
And this law is giving us enabling environment for the corporation to be, the management to be foremost and active, and for people to get more water, as it were, including getting more monies to manage the water utilities.
Niger State government, in collaboration with USAID, has again embarked on the rehabilitation of water supply facilities in Minna, the Niger State capital. 14,000 new lines are being reticulated, which were made possible by the American people through the USAID Effective Water, Sanitation and Hygiene E-Wash program. Only 5 states in Nigeria, including Niger, are benefiting from this program.
Niger State will feel more of water supply, more of the revenue for the facility, and at the end of it, people get more water.
All these are potent milestones and successes recorded by the Abubakar Sani Bello-led administration in the last 6 years. These are not by any means the end, as Governor Abubakar Sani Bello intends to do much more for the citizens of Niger State.